Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to talk about COVID-19 and update. Now, I know what you're thinking. You're saying, enough of COVID-19. I'm tired of hearing about the virus. I'm tired of hearing about wearing a mask. I'm tired of social isolation, and I'm really tired of hearing about vaccines. Now, all those are really important aspects that are given at this time. But because the virus is not going to go away anytime soon. But as a medical advocate, you need to know your options and what you can do to protect yourself against this virus. And that's really my emphasis tonight. But I got to give you a few statistics first. That's important. And these are as of this week, as of October the 9th. So as of October the 9th, in the United States, we've had 44,306,187 cases of COVID-19 and over 713,000 deaths. And that's in the 19 months of this virus. And just keep in mind that about 700,000 people die of heart disease every year. So this is rapidly becoming a major cause of death in this country. California, 4,536,000 cases and over 70,000 deaths. Now, also, did you know that the conditions are improving across the country right now because of the campaign to get more people vaccinated? And truly, it has improved lately with almost every state. But, we can't hold on to these false hopes because you might remember that in the early spring, we were looking pretty good, right? Gyms were opening and people were starting to let their hair down. And what happened, then Delta was coming, the Delta variant. And all of a sudden, things got worse. Like really fast. They were having more deaths and mostly with unvaccinated people. But indeed, there were more hospitalization deaths, like all over again, a major surge. And what you need to know is that there are more deaths. There are more deaths in 2021 than there were in 2020. Is that unbelievable? So the death rate, although it's looking better now, it's clearly, this year has been pretty major toll. There's still about 1,700 deaths every day in this country, most of those who are not vaccinated. As to date, about 68% of Americans are fully vaccinated. About 76% have had at least one vaccine. And California is ranking pretty high. What you need to know is that vaccinations do have their role, and they have prevented nearly all COVID-19 related hospitalizations and deaths. So no question, they've had their role, and also they have helped us to decrease the spread of COVID-19. So the vaccines are effective, at least initially, and they are so effective against variants. Are there potential problems with vaccines? Of course. There are problems with everything. If you want to dig up something bad about a vaccine, you'll find it. But all conspiracy theories aside, it's about, I always tell my patients, it's a benefit versus risk ratio. If the benefits outweigh the risk, you do it. And that's how I feel about the vaccines. But yeah, you're going to find you'll dig up some dirt about it, like we do with any medication, any type of therapy. And the important thing is that even if you do have people that come down with the COVID-19 after they've been vaccinated, their course is a heck of a lot shorter than those with the initial infection that were never vaccinated. So keep in mind, there are some major advantages. But I want to just go over, I was looking in headlines this past week about what's happening in the COVID world. I mean, I could have picked 15 articles, but these are 5. I'm just going to read you the headlines. Pfizer's vaccine protection may wane after 2 months. Really? I mean, when we first got our vaccines, I got mine in December before Christmas. They said, okay, the first vaccine, you get 72% immunity. And then the second vaccine, which you get 3 weeks later, you get like 92%, right? And Moderna was about the same, maybe slightly better, but they didn't tell us that it wasn't going to last too long. We thought it was going to last for several months. And in all fairness, we really didn't know. Now they're saying after 6 months, all bets are off. That's why they're saying now that if you're in a high-risk group or over the age 65, when your immune system is not as good, they're now recommending this third or this booster dose. So again, we didn't know that. We thought it would last much longer than like 6 months. So that's Pfizer, and I don't think Moderna's could be much different. Second one, new reports help nail down the myocarditis risk with COVID-19 vaccine. Okay, I'm a cardiologist, so I obviously care a lot about people that come down with myocarditis. First of all, it is relatively rare. and it's really rare. And those that come down, usually they're boys and young men from the ages of 14 to about age 29. And they're generally pretty self-limiting and mild. Very few end up in hospitals. And I believe there's been 2 deaths out of all the patients that have had myocarditis. For sure, myocarditis related to a vaccine is much less severe than myocarditis in a person that's unvaccinated, because that can rapidly lead to death and heart failure. Number 3 article, hypercoagulability and thrombosis in COVID-19, a modifiable cause for mortality. That doesn't sound very good. We know we learned early on that there's a hypercoagulable state that comes with COVID-19. It's more than likely due to a dysregulated immune system. Most commonly, we see blood clots in the legs, lower extremities, which can travel to the lungs and cause what we call pulmonary embolus, which in itself can be fatal. We also see clots in the lower legs. I've heard that Broadway actor, whose name I forget, actually had to have an amputation because of a huge blood clot to the legs. There have been also major strokes in young people with very little warning. And then autopsy studies that those that have COVID-19, like 80% of them have showed small microthrombi in various organs, including the brain. So pretty discouraging. Number 4, COVID immunity through infection or vaccination. Are they equal? There's a big controversy now. A lot of people want you to think that the immunity with the vaccination is not nearly what you would get from the infection itself. We don't really have that information. I think there is definite immunity that is achieved through the infection itself, and then probably added immunity if you end up getting a vaccination. But I'm not so cavalier saying that, oh, well, I've had the infection, so let's not even concern ourselves with getting a vaccine. We don't really know the answer. I think if they're equal immunity, we just don't know. But I think it hasn't really changed the course of time. If you've been vaccinated, if you have the infection, still it's recommended that you have a vaccine within, let's say, 3 to 6 months afterwards. And here's the clincher here. Neither the FDA or the Center for Disease Control wants you to think that we can measure this, which is really wrong, because we can find out whether the antibodies that are coming from the infection or from a vaccine. There's ways of detecting that, but they don't want you to know because they don't want to do this test. So again, we're kind of in the dark about that. And the 5th article, fully vaccinated and had COVID-19, no rush for booster shot, experts say. If you've had both, don't rush. Because several people say that if you had the fully vaccinated, you have a strong protection. But then again, I know people that have gone on to have been reinfected. My sister was one of them. We all know someone that had an infection, infected with COVID after being vaccinated. The truth of the matter is these are usually milder cases. So now we knew this new term called hybrid immunity, meaning you're immune from both the infection itself and from the vaccination. And lastly, a study published last month by the CDC shows that unvaccinated people with previous COVID infections were more than twice likely to be reinfected compared to fully vaccinated people. So a lot of people that I know that have been vaccinated, that have been unvaccinated, think that once they have caught the virus, they're set for life and that they shouldn't get vaccinated. But research is showing that that's really not true. You don't have full immunity for life. Nobody does. And so enough of all this, because I can go on, and because it's very confusing. It's like I've been saying this since day one, well, month 1 of this whole pandemic, is that the more I learn, the less I know. And I think a lot of you probably feel the same way. And I've really been on top of this since the very beginning because it's such a multi-system disease. And being a cardiologist, I have to know what's going on. So let's now want to focus on why we're here. And let's talk, what can we do? And I want you to know, I've been also saying this since I started my YouTube live last September of 2020. And I think in October, a year ago, I talked about COVID-19. I talked about what people can do to improve their immunity and their metabolic health. And that's really what it boils down to. So what happened with COVID? People stayed at home. They didn't go out. They ate comfort food. They watched TV. They played video games. Their sleep habits were oftentimes altered because of stress and isolation. But here's what you got to know. 42% of people gain weight during COVID-19, 42% of the population. That's almost half, right? And what is the average weight gain for these people? Let's say anywhere from 21 to 29 pounds. That's a lot of weight. What really disturbs me the most is that children ages 6 to 11, the obesity rate doubled during this time frame, doubled. And these kids are set for life. I mean, they're set for life. When you develop fat cells at that early age, you'll always have the fat cells. I mean, you can shrink them down and you can build them back up, but they're not going to go away unless you do liposuction. So these kids are never going to probably lose weight. They're going to have a very difficult time. And that's all we need is a younger population who's less healthy than their parents. And what does this happen? This is most commonly in the weight gain as Hispanics, Blacks, and indigenous populations, which they're the ones that had the most severe cases of COVID. So that's the weight gain situation. What did the media report? The media did report that people are skipping exercise, drinking soda, and eating fast food. Wow, they reported that, but they didn't give you any recommendations about it. And this is what really makes me burn, because I don't care whether you're talking about government officials or you're talking about the head doctors from Dr. Fauci on down, Dr. Gupta and CNN and all these other famous doctors that you see on TV. They all talk about vaccines and the deaths and all the things what do they talk about lifestyle? What do they say about prevention? Nothing, right? And that's why as medical advocates, we can't fall for that. We can't fall prey to that. We need to step up to the plate and we need to be proactive and preventing this disease, because it's not going to go away. These headlines I just read for you are real. They just came out this week. Those are 5 different headlines from, and there's I had to pick and choose. There were like 15. So it's not going away. So what can we do as medical advocates to prevent, to improve the status of our health? And I think I always start off with diet, and it's basically sugar. Avoid the carbs. Now, I just Googled last night or a couple nights ago, sugar and COVID or immune system, and I got 691 million choices. I mean, I didn't Google them all, of course, but it's ridiculous. So sugar consumption in particular has been shown to affect COVID-19. Why? Okay, first of all, here's the most important thing that I've been saying since day one, and that is sugar competes with vitamin C for your immune system. They have a molecular weight that I think is similar, and when it comes to the receptor sites on all your cell membranes and so forth, if sugar is available, the cell's going to take that over vitamin C, which is really bad because vitamin C is probably your strongest vitamin to help build an immune system that's strong, and sugar does the opposite. So, and not to mention the inflammation that comes from sugar. And I've been saying this forever too. Eating sugar is like pouring gasoline over a fire. It's all the diseases of aging, heart disease, cancer, autoimmune disorders, and Alzheimer's. They all have one thing in common, and that is inflammation. And this disease is all about inflammation when you look at COVID-19. So sugar is the worst culprit. And and we're talking also starchy carbs. If it's white, don't eat it. Pasta, rice, it's all garbage, Carbs do add texture and variety to our diet, but they don't offer anything of nutritional value other than vegetables and fruits, which are a different category. So that's the most important thing is, and here's another thing that I thought was interesting. I just read this. Restriction of free sugar intake has a measurable effect on disease in as little as 9 days, which means in as little as 9 days of cutting back on sugar, we can see improvements in physiologic parameters. It's amazing. So we want a strong immune system, and we need to avoid or limit the amount of sugar we take to make sure that happens. And again, vitamin C and sugar have very similar chemical structures, and I thought most people really know that. Snacking. Now, snacking also is bad. Snacking adversely affects the immune system. Now, it's really interesting because I've been doing intermittent fasting for like over 3 years now, and I love it because snacking is something I no longer do. Very rare occasions. And I feel better. My moods are better. My insulin levels are more stable, and I'm leaner than I've ever been, except when I diet for a bodybuilding contest, and that was certainly wasn't healthy. Snacking is kind of like emotional eating, and there's the old thing about adage about having multiple meals per day helps you burn calories. Where was that? I never saw anything scientific about that. It was, I think the bodybuilding community had to help perpetuate that myth, but believe me, eating 6, 7 meals a day and snacking and grazing all day long is like not cool anymore, not in 2021, especially with COVID-19 going on. Fast food activates the immune system in a very negative way. It's been shown to do that. There's no room for fast food. Let's talk about supplements. Now, the most important vitamin really is vitamin C. It strongly promotes your immune system. Also, vitamin D3. Vitamin D is more than just a vitamin. It's a very strong it has an anti-inflammatory effect. D3, zinc is an important mineral. And I actually have my own and I put this together at the very beginning of the pandemic. I said, I got to come up with a supplement that has all this, so you're not grabbing one bottle after another. So this is my ImmunoEyes. I don't know if you can see it. So ImmunoEyes has 1,500 milligrams of vitamin C. It's got 5,000 units of vitamin D3. It's got 35 milligrams of zinc. It's got 300 milligrams of quercetin, which is a natural anti-inflammatory agent, quercetin, and it's got 500 milligrams of NAC, which is N-acetylcysteine, which is a precursor to glutathione, which is the strongest antioxidant in the body. I didn't make this stuff up. I just put it all together in one bottle, so you wouldn't have to be looking all over the various bottles. But that's you need supplementation, unless you're eating healthy all the time. And with this pandemic going on, I thought most people were eating really healthy. So I do think vitamins are very important. And also I'm very fortunate to have an RN twice a week in my office. So we do what's called IV nutritional therapy. So we can do this intravenously, which is very good because we do what's called a Myers cocktail, which is B vitamins, magnesium, calcium, zinc, vitamin C. We can give extra doses of vitamin C. People that have a weakened immune system, people that want to strengthen their immune system, because you don't have to worry about absorption from the GI tract when you're talking about IV therapy. So there's a role for IV therapy, certainly during a pandemic. A lot of people want to protect themselves even more. So that's something that's offered. Many offices do it, IV nutritional therapy. That's something else to look at. And the other thing is exercise. Exercise is so important. Exercise strengthens your immune system. Okay. So I don't care what you do, but you got to do something. And unfortunately, when gyms were shut down and we were told to stay inside, it wasn't cool. I mean, we had to do what we had to do to stay alive, but it wasn't good. Social isolation wasn't good. Stress and poor sleep habits resulted from that. I had many patients, especially my elderly patients, who developed panic attacks in their 70s and 80s that they never had before because they were living alone and they couldn't go anywhere. It's very sad. In this population. So there's a multi-pronged approach that we need to develop. We're talking about developing a strong immune system. Another thing is is to be healthy metabolically. Now, some of you might remember from a few months ago, and I talked about metabolic health. And you may remember from this study at University of North Carolina at Chapel Hill that only 12% of us are metabolically healthy. That means 80% are not. What does that mean? Diabetes, prediabetes, obesity, fatty liver, polycystic ovarian syndrome, big waist circumference, high triglycerides. That's the average American right now. Not just average, that's more than average, right? And so people that are metabolically unhealthy don't do well with COVID. So in ending my little discussion here, what we need to build as medical advocates, number one, a strong immune system to fight this thing. And number two, a metabolic milieu that's healthy. And that's really important. And that's what to do for you, what media has not done. And that that there are things that we can do that are positive and possible to avert disease. So thank you for listening. And now I'd like to take something. Oh, I got a lot of questions. So senior moment to put my glasses on so I can read this. Okay. Wow, COVID-19 is more than a bad flu. This is not Ebola. It's not SARS. It's politics playing medicine. And that's a very dangerous game. You're absolutely right, Dr. Roger Hodge. I don't know him, but I think the bad thing is that this whole pandemic was so highly politicized from the beginning, which really made it more difficult, certain and sad. Anyway, let's go on from there. Okay. I'm trying to think now. What are your thoughts on vitamin D levels and quercetin for preventing severity? I already kind of mentioned that. I'm very big on both of those. I do vitamin D levels. I do them on all my patients. So then if you look at the average, the range is anywhere from 30 to 100. Well, why would you want to be 30 if you could be 100, right? It's a very wide range. I like my patients to be at least 60, and I go up to 80 or so. I don't like it over 100 because it is a fat soluble vitamin and potentially you could get toxic effects, although I've never seen it. I've never seen toxic person with toxicity from vitamin C. But I do, I'm sorry, vitamin D. Did I say, yeah, vitamin D. So vitamin D, I look for levels between 60 50 to 90, let's say, which is what I like. And I think that, and it's been shown, I didn't mention this before, but I'm sorry I didn't, that people that did poorly with COVID-19 generally had very low vitamin D levels. But it's not just that. People with low vitamin D levels also do poorly from a cardiac standpoint. They have more heart attacks. So I'm very bullish on vitamin D because it's so much more than just a vitamin. It's very important for the immune system. Okay. What is up with vaccine side effects? I had no reaction to the first two vaccines. This is very funny. Thank you. Yeah, this particular person I know quite well, but I'm hearing more stories now that I would think that getting the third vaccine, the booster they call it, would be the same as getting the second one, but it's not in some people. And I heard another person today who had that very same complaint. They were violently ill for like 24 or 36 hours or so. I can't explain it other than the fact that you probably have a very strong immune system or that's trying to fight it. But it's as more people are getting the booster now, it's just coming out now as the booster. So we'll be hearing more about it. I don't know whether you just and bad luck that you had that reaction, but everybody's different. So let me go on here. I'm so glad you brought up the fact that cell issue and overweight. Yeah. I see this person, Shrink Shop, who's very much involved with weight. She helps a lot of women out there. But I think it's shocking so many of us to know that these children, 6 to 11, Okay. Okay. We really don't have room for any false information on here. So I'm not going to mention any names, but there's some false information here. This is not the forum for that. Okay. I'm deliberately not bringing up controversial issues. So if you want to find that, you can go elsewhere. Okay. Okay. What about resistance exercise versus cardio? They're both good. Cardio is great for building your your cardiovascular system. It improves circulation of the tissue. And I'm a strength athlete, so I'm a bodybuilder, so I love resistance exercise. I do both because I think both are important. There's definitely, and I'm going to be talking about exercise in one of my upcoming YouTube lives. So as far as COVID-19 is concerned, they both augment your immune system. That's what you need to know. They both have a positive role on building your immune system. So I don't think you can go wrong with either. A little bit of both is good. Are there new variants? Yes. As long as people aren't getting vaccinated, you have to remember, the more you vaccinate, the less you mutate. It's common sense, right? I'm hearing, I don't know which new ones are out. I've heard a couple of them. You guys may know more than me, but we're going to be hearing more variants. As long as we don't have a handle on this pandemic, we're going to be seeing more and more variants. So none of this surprises me. Okay, let me see what else is here. Okay, let's see. Let's see. I have a couple of other that I got here. I want to also mention this. I looked this up. There are other foods that can weaken the immune system. I really mentioned about sugar because it's so important, but here's the other one. Salty foods, foods high in omega-6s. You know that I've talked about different fats in the past. Omega-3 is your friend. Omega-6 you never have to worry about, because omega-6 is essentially any processed food in a bag or a box. You're going to see omega-6s. So omega-6s are not good. They're pro-inflammatory, as opposed to omega-3s that are anti-inflammatory. Processed and charred meats, fast food we talked about, food that contains additives, and highly refined carbs, which is what most people are eating. Let's see. I didn't talk about long haulers, because now we know there's three classes of people that have COVID. 80% still have very mild cases. These are the ones that never hit the hospital. And usually these people have their symptoms come and go in a matter of 2 weeks. Severe infections, the people that live can have symptoms 3 to 6 weeks. Then we have the long haulers, which is about at least 10% of the population that get it, and they can have symptoms lasting 3 months or even longer. And usually what we commonly see are fatigue, some residual respiratory problems. I have one of my, I stopped counting, but I think I've had about 80 patients, or maybe 90, with COVID, 2 of whom passed away, did not survive, but they were elderly and not in great shape. One person had metabolic syndrome, obese, high triglycerides, poor diet, early 40s, and is a long hauler, has had some respiratory issues, but most people have done well. Okay, a few more questions. Good. Has it changed in regard to children getting COVID? It seems more younger children are getting it now. Is that true? Well, I think it's because they were the ones that were not vaccinated. Now they're just, I don't know if I'm into this yet, but they're now saying that children, they're opening up vaccinations for children. Now, before it's like, 12 years old was the cutoff. Now they're saying 6 to 12. I don't know. I'm not quite ready for that yet myself, but we may be suggesting that. I mean, I remember when I was a kid getting a polio vaccine. So we don't know yet. But I think children are definitely, I mean, my oldest daughter, we think that her son, who was like 4.5, brought home COVID from school. So kids they tend to have the mildest cases, but they do bring it home. Any permanent damage to the heart from COVID? Absolutely, there can be, and that's why. I mean, I've seen a lot of people with COVID, but with COVID, you could have a heart attack. You could have thrombosis in the actual coronary arteries, and the myocarditis. The myocarditis from the virus itself, not from the vaccine, can be very, very serious. And these people could develop what's called a cardiomyopathy, and that's basically permanent damage to the heart as a result of the initial inflammation, which comes from a virus. So we've had cardiomyopathy. I've had cardiomyopathies for patients for years, way before COVID-19, and some will get better on their own, and through the grace of God. But a lot will develop cardiomyopathies, and they have permanent organ damage. So yes, that's very possible. It definitely is. The heart is the one organ we really have to look at. Let's see. How many body systems are involved? Every body system is involved. So you got the heart. Well, you got the lungs. That was what we first thought this was going to be, a pulmonary infection. But it's the heart, the lungs, the brain, the blood vessels, the hematologic system, our blood clotting system. And also something I recently learned, the kidneys can be infected. And this is very interesting. I just read about this. This is about a week ago, that you can develop acute kidney failure, chronic, and even end-stage kidney disease, or with COVID-19, even in mild cases that don't require hospitalization. We're talking about like 500,000 people. So we're appreciating the long-term effects on the kidney now that we did not know about. So that's the latest organ that seems to have a really deleterious effect, a damaging effect. Okay, what medications reduce the effectiveness of the vaccine? Great question. I don't think, I mean, it's a good question, and it hasn't been answered, as to my knowledge. What medications reduce the effectiveness of the vaccine? Wow. That's a very good question. I don't know that. But I will say this thing, and this is where I think we need to go. First of all, and I think it's going to have to come from us, but there are ways of being able to quantitate your immunity. So right now, if you get a regular test, let's say, oh, you got antibodies, you don't. We need to know quantitate where we are. How high is your antibody titer? There's a couple labs that are doing it, but they aren't widespread yet. And I'm starting to work with one now, but I'm not going to mention it yet until I really have experience working with them. That will actually give you more of a quantitative idea of your immune system. But here's the thing: the government, the FDA, and the CDC, they're not pushing this. They don't really care. They don't want. I don't know if they don't want us to know how immune we are, or we. And those of you that know me know that I'm not a one-size-fits-all kind of doctor. Whether it's diet, whether it's supplements, I don't believe one size fits all. I don't believe one vaccine fits all. And I think it's going to be really important to know an individual's immune system. Like I may need to have a booster every 8 months. One person may need to have it on a 6-month basis. Some people may need it every other year. And that's what we don't know. So it's like everybody's going to get a booster because if you're over 65 and you have any pre-existing problems or if you're considered immunosuppressed, you're going to get a booster because that's what they tell you to do. But is the science behind that? I don't see it. So I would like to see more data on so that we can individualize who gets a booster and when. That's my thing. Yeah, immunosuppressants are definitely. Okay. That's a good. Yeah. So people that are on kidney transplant patients, they're on these very heavy immunosuppressants. And we don't know whether it's the drugs themselves or well, they are in an immunosuppressed state. It's very interesting. Is it the medication or just the fact that immunosuppressed? But any kind of transplant patient, they're automatically immunosuppressed, and they're told at the beginning that they may need more frequent vaccination. And I understand that. Yeah, that's for sure. So that's one class, and that's a lot of people because a lot of people that's with autoimmune disorders in the non-functional medicine world are placed on immunosuppressants because the doctors in traditional medicine really don't deal with autoimmunity the way we would want to deal with them. We want to deal with them. What's causing the autoimmunity and what can we do to suppress it? Their thing is let's just suppress the immune response. So they use corticosteroids and they use immunosuppressants and they wipe it, they get you in a remission and yet your disease comes back. I mean, I had a patient I sent to UCLA who had a vasculitis related to Sjogren's syndrome. And when she said, well, this is my stool sample from Dr. Elkin, we're working on my nutrition. They said, no, we don't do that here. We just give you steroids and immunosuppressants and, get you in remission. And then she said, what happens if I come back with another relapse? Well, we give you more drugs. And that's UCLA. And that's, this is just a couple of years ago. So it's pretty scary. Okay, let's see. Yes, permanent lung scarring. That's another one. You can have you can have permanent heart scarring, cardiomyopathy, and you can have restrictive lung disease. And I had one of my cath lab techs, a nurse, very overweight, young, I think maybe early 50s, and he had a very severe case COVID early on. It was probably like a year ago, a year and a half ago maybe, but he was in ICU for many weeks, and of course does have some permanent lung scarring. So that's the problem is that we don't know. And that's that whole thing, which I didn't go into this time, but I did last year with cytokine storm, in which we don't know who is going to have a more hyperacute response to the inflammation. Some can contain it and some can't. And again, we don't really know. That's individual differences. So the ones that can contain it can definitely go on to have permanent scarring in the lungs and the heart. And now, as I just told you, in the kidneys. So there's some long-term sequelae of this disease. It's really important that we keep that in mind. Okay, great questions, you guys. I just want to make sure I didn't miss anything. Yeah, someone mentioned, 62% of people do not develop blood clots. Yeah, again, I'm trying to avoid controversial issues here because there's other forms for that, and I really don't want to. I want to keep it to what we know medically and what I think is important from a proactive stance. That's the whole purpose. It's not to point a finger. Like I said before, if you want to find something bad, you can. I think that's it, you guys. I think I answered everything. I'm just going through my list one final time. But thank you. So again, in essence, I just want everybody to know that we all have a role in helping ourselves, whether it's this pandemic whether it's some other disease that happens. It's all about being proactive about our health. Again, we want to maintain, whether it's, no matter what it is, a strong immune system, and we also kind of keep ourselves metabolically healthy, and that's keeping our weight down, exercising, and avoiding sugar. Okay, thank you guys. I will see you in, actually, it won't be 2 weeks because I'm going to be in Florida visiting my sister's daughter is getting married, so I won't be here. So it'll be 4 weeks. Okay, we'll see each other in 4 weeks, and I got some really exciting programs lined up for you in the future. So happy Halloween, and I'll see you guys in a few weeks. Thank you so much. Appreciate it. Okay.